Okay, welcome everybody. So we are going to get started. I just want to say my name is Melissa and I am the Executive Director for the Movement Disorders Foundation of Arizona. Welcome everybody also on Facebook Live. We have two speakers today and a couple of our sponsors that will be sharing a couple of information regarding the company they are representing. And just a couple of reminders, if you do have any questions, please type your question down below on the question bar, and your questions will be answered after every speaker. Also, if any questions don't get answered throughout the presentation, we will email you and send you the answers for your question. Also, all registered attendees will get an exhibitor guide that will provide you guys with sponsor links, sponsor brochures, and any information that you guys might need from your sponsors. If you have questions for the sponsors, you are also able to put those in the question bar below and just specifically put for what sponsor that is, and they are able to answer your question as well. Um, Without any more delay, I think we could get started. If you do guys have questions or concerns, this is the way to contact me. This information will be on at the end of the presentation as well. My email is on here, director@mdfa.us, and my phone number is 480-403-4635. And our first sponsor today is Boston Scientific, and we have Matthew here representing.
Thank you so much, Melissa. Yes, my name is Matt Demore, and I work with Lindsay McGuire here in Phoenix for Boston Scientific. We manufacture deep brain stimulation systems called Vercise. We have a standard lead and a directional lead, and a regular battery and a rechargeable battery. And Melissa's going to show a little video of one of the patients that has our system implanted.
My name is Kenneth Brown. I'm a pastor in Fountain Hills, Arizona. Back in my 50s, I was able to walk in the Grand Canyon, hike all the way in to Phantom Ranch, and back out again, a 23-mile round trip. That became history with the onset of Parkinson's. I lost the ability to do that because my legs would tighten up and my back would begin to curl, and I'd be walking bent over, and I just realized I can't do this anymore. I had to give it up, and that was very frustrating. I found out about DBS surgery as a result of a guy in town who was the editor of the newspaper who had DBS surgery. And as soon as I read about it, I said, that's what I want to do. The reason I chose Boston Scientific is because of the lifespan of the device, at least 15 years with the battery in the device. And I'd heard about people having 3 or 4 years and having to change the battery out. And I didn't want to keep getting cut open over and over again. When I first had the DBS device turned on, I experienced no tremors. Within a day or two, my toes were no longer curling. When the doctor told me that you had to recharge the device, how do you recharge something that's in your chest? The doctor pulled out a collar like this and put it around his neck and said, just like this, when you hear a triple beep, it's done. And I thought to myself, well, that's a piece of cake, I can do that.
Okay, thank you. We have Amnio next, and we have Christy here.
Hi everyone out there in Zoom land. Happy to be part of the webinar today. I am one of the local reps for Amnio, and we make a medication called Rytary, which is an extended release form of carbidopa-levodopa to treat Parkinson's disease, and it's indicated for all stages. It's basically a time-release technology, and it's been proven to work in a wide range of patients, those being levodopa-naive patients, where Rytary demonstrated significant improvement in your activities of daily living and motor fluctuations. Also, there's a head-to-head study comparing Rytary to an optimized immediate release carbidopa-levodopa. And in that study, there was twice the reduction in a patient's off time during their waking hours and twice the increase in their on time without troublesome dyskinesias. So it was the good on time. I should point out in regards to safety, Rytary is contraindicated in anyone taking an MAO inhibitor. And we encourage you to visit rytary.com for more information as well as safety information. And with that, Melissa has a quick video from our VP she would like to share.
Hello, I'm Scott Hunter, Vice President of Sales and Marketing at Amnio Pharmaceuticals. We are very excited to be part of this incredible event, and we are confident it will provide a great spirit of community, education, and inspiration for people living with Parkinson's, their care partners, and families. At Amnio, our team comes to work every day with all of you in our minds and hearts. We are passionate and dedicated to our work in Parkinson's disease. Again, we are so glad to partner with you today in this event and wish you the very best.
Thank you, Christy. We have
Hello.
Kyo at Medtronic next, and with Medtronic we have Jill.
Welcome, everyone. It is such an honor to be part of this great platform today. My name is Jill Wallace, and I am one of the local representatives here in Arizona. I do accompany 4 other teammates that do support the greater Arizona area with deep brain stimulation therapy. And Medtronic offers a full platform of devices with both rechargeable and non-rechargeable devices. And we're really excited to announce our 5th generation device that we are recently introducing to the field. And we would welcome and encourage you to visit medtronicdbs.com to learn more all about it. Enjoy the presentation and platform today. Thank you.
I've had Parkinson's now for almost 10 years. I was a father and a husband and a career real estate guy. And I was an athlete, and then I was 47 and I got Parkinson's. I felt sorry for myself for a little bit of time, and I had anxiety over my wife's situation. You know, she didn't marry a guy with Parkinson's.
Brian talked with his doctor about DBS when Parkinson's disease began to limit his freedom.
For me, DBS has been a game changer. I look back and I remember how bad it was. It has improved my situation so much, I almost take it for granted.
DBS therapy requires brain surgery that may include serious complications such as coma, bleeding inside the brain, seizures, and infection. DBS therapy may cause worsening of some motor symptoms associated with your Parkinson's disease and may cause speech and language impairments. For more information about DBS, visit medtronic.com/dbsinfo or call 1-866-617-7246.
Awesome. Thank you, Jill. We have Kyo next, and with Paul.
Yes, good evening. My name is Paul Hollywood. I'm with Kyowa Kirin. Our company has a medicine for Parkinson's disease called Noreonce, and this is the first time we've been able to join your organization. We're very excited to be here, and Melissa is going to show you a short video, a little bit about our company.
Yes, thank you.
The reason I joined this industry was for the patient. And so commitment to life is really the most important value to me personally. You know, our tagline is taking the walk of life, one life at a time, really making sure that we're doing the right thing for the patient.
So innovation is at the forefront of everything we do in the research labs. Applying novel technologies, sourcing novel ideas from other academic institutions and bringing them into our organization.
Of the 3 products that have been approved, they've all been first-in-class new molecular entities. That's innovation.
As a clinical trial manager, one of the primary responsibilities is to oversee the conduct and the execution of the clinical study. And so without the integrity, the reliability of the trial results could be compromised.
So my favorite one is teamwork, but not just teamwork, but teamwork WA. Because the WA part is the feeling. Teamwork is the American side of what the corporate values are. But when you integrate the Japanese WA, which to me is a feeling, that spirit of working together, that's the important one of the cultures to me.
We have to connect with all of them on a day in every project we do. Commitment to life is the core of what we do because we are very focused on communicating the data, finding new data, getting new research for the patients. But you can't do that without teamwork, and you have to do that with integrity. And then we use innovation. They're all working together in our role, yeah.
Thank you, Paul. And we have our next sponsor is UCB, and we have Patrick here.
Thank you, Melissa. I'm honored to be here, and thank you everyone for participating, and thank you for your engagement this evening. I'm the local rep in Phoenix, and I also cover Las Vegas, and UCB we're very proud to be part of this event tonight. And without further ado, Melissa's going to present a video from UCB. Thanks.
At UCB, everything we do starts with one simple question. How will this create value for people living with severe diseases? Our commitment to patients is embedded in our core. From how we work, to how we think, to how we hire, and from where we focus to where we invest. It is our patient value strategy. We deliver differentiated medicines that help patients achieve their goals and work to provide improved access to these solutions. We relentlessly innovate, both in how we rethink the patient journey and in our significant R&D investment to incubate new solutions. Our relationship with patients extends beyond medicines to include programs, partnerships, communities, and philanthropy that support their overall care experience. By putting patients at the heart of everything we do, we enable people to live their best lives, delivering impactful solutions patients value.
Thank you, Pat, for that. And our next sponsor is Adamas, and we have Jeremy here.
Hello, everyone. I'm Jeremy Killian, and I'm the representative with Adamas Pharmaceuticals, and I'm really thankful to be a part of this webinar today. Now, GoCovery is the first and only FDA-approved medication indicated for the treatment of dyskinesia in patients with Parkinson's disease. You can also learn more about GoCovery in the exhibitor guide and at gocovery.com. So thank you for your time, and I really appreciate everything. Thank you, Melissa.
Thank you. And our next sponsor is Accorda, and we have Steve.
Hello, everyone. I'm Steve with Accorda Therapeutics. We are the makers of a product called ABBVIE, which is the first and only inhaled levodopa used for off periods, whether it's a morning off, middle of the day, a random time. Whenever you as a patient want to be in control of your symptoms, you take 2 capsules and one at a time, you insert it into the chamber, click on it, inhale, and then as soon as 10 minutes and lasting out over an hour, your symptoms are back under control. It's really designed to give you control of your symptoms when you need to have control, whether with your grandkids or whether you're just at home or needing to go to the doctor, whatever the situation is, when you want control, 2 inhalations can give you that control. And if it sounds like something you're interested in, obviously, please follow up with some of the information you're going to see next Monday, or talk to your physician. Pretty much every doctor that I call on has samples for you to try as well. So thanks very much and have a great day.
Awesome. Thank you, Steve. And our last but not least, our next sponsor is ABBVIE, and we have Marjorie here with.
Apologize for the technical difficulties. My name is Marjorie Crenshaw, and I'm your local representative with ABBVIE, the makers of Duopa. Thank you to the Movement Disorder Foundation of Arizona for hosting tonight's event. Duopa is manufactured by ABBVIE and was approved for use by the FDA in 2015. I would just like to take a quick minute and take the opportunity to share a valuable resource with you, which offers the ability to learn more about Duopa therapy. Duopa.com is an important educational resource and our therapy website. What you are viewing at this time is our Duopa.com homepage. If you scroll down on our homepage, you have the option to learn more about how Duopa is delivered. You can watch some patient videos and learn from other patients. And finally, here on the right, you can connect with a Duopa nurse. You can reach out to our nurses to ask therapy-related questions. They can send you educational materials directly to your home. They can help you locate a movement disorder specialist in your area who is experienced with Duopa. And most importantly, they can connect you to a peer mentor who is another Duopa patient, or a caregiver who can share their own individual experience. As a reminder, only you and your doctor can decide if this treatment is right for you. And thank you everyone for your time this evening.